There are three factors that influence ventilation, or the movement of air in and out of the lungs. The first one is the resistance to airflow. We've talked about resistance before. We looked at resistance with blood flow, and you had to learn this equation where flow is equal to the pressure gradient over resistance. In this case, the pressure gradient is the gas pressure gradient. Remember, if you increase resistance, flow will decrease. If you increase the pressure gradient, flow will increase. We've already discussed changing the pressure gradient. This occurs by either expanding or decreasing the size of the thoracic cavity. Remember, the muscles involved in inspiration increase the size of the thoracic cavity, and the muscles involved in forced expiration will decrease the size of the thoracic cavity. In addition, remember when the inspiratory muscles relax, that will also decrease the size of the thoracic cavity, which is what occurs during quiet expiration. Several forms of resistance exist. Tube diameter is one of those. The larger tubes in the beginning of the conducting zone are so large that they don't offer any resistance. And the progressive branching of the airways as they get smaller leads to an increase in total cross-sectional area, so they don't offer a lot of resistance. The main tubes involved in offering resistance in your airways are the medium-sized bronchi. Other forms of resistance include any type of obstruction, such as a buildup of mucus, which could occur during cystic fibrosis or the presence of a tumor. A second factor that influences ventilation is the alveolar surface tension. Remember, water molecules are attracted to one another. The alveolar wall is moist, and the water molecules along that wall are attracted to each other, which leads to a decrease in the size of the alveoli or a collapse of those alveoli. There is a lipoprotein that alveolar type 2 cells produce decreases this surface tension. In premature babies, a condition called infant respiratory distress syndrome may occur due to a lack of surfactant production. The third factor to influence ventilation is lung compliance. Lung compliance is dependent upon how easily the lungs stretch. Healthy lungs will distend very easily. They are elastic, and you have surfactant being produced in the alveoli to decrease surface tension. Compliance decreases when certain diseases replace the elastic tissue in the lungs with fibrous connective tissue or scar tissue, making it more difficult for the lungs to stretch. This condition is called fibrosis. Decreased surfactant production will also increase surface tension, making it difficult to stretch the lungs. Remember, surface tension causes the alveoli to collapse. In addition, anything that decreases the flexibility of the rib cage will decrease compliance. Several things that can do that are deformities of the thorax, ossification of the costal cartilages that occur with aging, paralysis of respiratory muscles, or obesity.